So how do we tackle these issues? Well, I think we really do need a new consensus with the public, both nationally and locally, because unless they're fully involved, fully engaged, as Derek Wanless would have said, it ain't going to happen. And for that, you need engagement, you need honesty, and you need realism. And I'm afraid from the politicians, there's been precious little of some of these, maybe until recently. We need to make it easier for people to make the right choices. There's no point in just lecturing them. But it is rather amazing when even you come into buildings like this, and it's much easier to find the lifts than the stairs, and how easy it is, or how easy is it to cycle around many of our big cities, and how many firms have changing rooms and showers when you get there. So unless we do a lot of things, simple things like that, we're not really going to make the gains we want to make. We've obviously got to tackle the issues like alcohol, smoking, have exercise initiatives, seen a lot of that outside at the various stands, food labelling too, which again helps people make the right choices. And as I say, I think we need a mixture of encouragement and legislation. I don't think we can just rely on the goodwill of industry to actually do it for us. Certainly the experience with the tobacco industry, yes, they put warnings on cigarette packets, but they're still in business to recruit new smokers to replace the ones they're killing. And to some extent, it's the same with the alcohol industry. Another little view, that's a loch near Aviemore in Scotland. I just thought it was a nice tree. I've been asked to talk a little bit about quality. So what is quality? Well, Ara Darcy, the late Minister for Health in the Lords, who produced his great report, said it really comprised three things. One was safety, so talking about cleanliness, avoidance of possible infections and medical errors. Patient experience, which is obviously very important. You know, how good was it? Was there compassion and caring and everything in the service they received? And obviously clinical effectiveness in terms of the outcomes, both clinical outcomes and patient-reported outcomes. And what drives up quality? And there's a lot of discussion about this. And I think, I mean, as a doctor, again, you need the right incentives in the system. And to some extent, there'll be a mixture of just encouragement and good practice, but you may need other incentives as well. There's a thing in the health service called payment by results. I'm afraid it's a misnomer. It's payment by activity at the moment. And although they've introduced some commissioning for quality and innovation, which is the sequin, it's still effectively you get paid how many things you do and not basically on how good it was that you did it. In general practice, we've had a thing since the new contract called the Quality and Outcomes Framework, which has its faults, but it's certainly nearer to a payment by results system than we've got anywhere else in the health service. What clinicians want to do, what drives them, is getting up in the morning and hoping that they're doing a good job. And actually, we're quite competitive. We like to know that we're doing a better job than our pals down the road. And I think that's where we must focus a lot of attention in the health service if you're going to drive up quality. But for that, you need really good quality data. And the data have to be relevant, they have to be measurable and reproducible, and they have to be timely. I mean, we are told we're lagging behind Europe in cancer survival rates, and I think to some extent we are. But cancer survival rates are 5-year cancer survival rates. So they're telling us what we were doing 5 years ago, not what we're doing now. It's still important to know what you're doing 5 years ago and whether you're improving. But you've got to recognise these sort of deficiencies in the data that we use. And the other things that obviously people talk about in driving up quality are things like regulation, both of organisations and of individuals. We're bringing in a system in the UK of revalidation for all doctors, which will mean that they have to demonstrate that they're still fit to practice and up to date. Reaccreditation for practices. We've got a system of inspection now with the new Care Quality Commission, and any providers, both private and public, will have to register with them and be inspected. And then, of course, you've got education, training and research. And I mention that because, as I said earlier, that unfortunately is often the first casualty of cuts. It's an easy, soft target, but in my mind it's one of the worst targets to use, because unless you have a properly trained, properly educated workforce that's doing good research, you're not going to get the right solutions in the long term.